Hi everyone, and welcome back to another INBDE prep video. I'm Macy, and today we're going to be exploring the ethical principle of beneficence, or the principle of doing good. This seems pretty straightforward, but there are many layers associated with this concept, and it concerns many relationships the dentist will have. The relationship with the community or public, with the work environment, with other medical professionals, and of course with the patient. I also think there is commonly some confusion on the difference between non-maleficence, which is do no harm, and beneficence, which is do good. These do sound pretty similar. The difference is that beneficence is focused on the positive impact you should ethically try to have on the community, workplace, and for the patient, like we mentioned. This goes beyond just doing no harm. We want to do good as a dentist. Now let's begin with a brief overview before getting into the details. The idea of beneficence prioritizes the well-being of the patient, and this concerns three main points. Firstly, your actions must benefit the patient and public welfare. It is especially important to note that contracts are not an exception. This ethical obligation to promote patient and public welfare stands regardless of how much you are being paid. This basically means that you cannot provide better care to patients who pay out of pocket versus those on government assistance or other fee-for-service arrangements. Secondly, the dentist must provide proficient and punctual care, and this takes into account the most clinically acceptable treatment sequence. If a patient comes in with several planned treatments, the dentist must prioritize certain treatments based on their knowledge and the health of the patient. For example, whitening should not be done while a patient has an abscess in their mouth. In addition, any treatment should be taken care of in a timely manner as to not escalate potential damage to the patient. The dentist should not just put off treating that abscess tooth because they don't feel like doing it today. Lastly, all aspects of the patient should be considered for treatment, such as when a patient is anxious. Care for a patient goes beyond just their oral needs. We need to respect their other needs, desires, and values. For that example of an anxious patient, you would ethically be doing good to make sure that patient is as comfortable as possible before hopping straight into the procedure. Talk to them, offer them breaks, offer them some music. The boards love to ask about treating the whole patient and making sure we give an anxious patient some time to rest and get comfortable before the procedure. Okay, so now that we have a basic understanding of beneficence, let's try a practice problem. Example number 1. An 18-year-old patient and her parents want veneers for her modeling career due to dull teeth. They insist on it, stating another dentist will do it if you do not. What should you do? A. Inform the patient that there is no need, explain the risk, and if they insist, do the veneers. B. Inform the patient that there is no need, explain the risk, decline the request, and offer the option of bleaching. C. Refer them to a dentist who is more willing to do the veneers. Or D. Agree to do the veneers regardless because patient preferences take priority. Pause it and take a minute to think about this question. The correct answer is B. Inform the patient that there is no need, explain the risk, decline the request, and offer the option of bleaching. Doing this treatment on this patient would be unethical. We definitely wouldn't be doing good by doing this treatment when she doesn't need it. So B is definitely correct because we want to inform the patient that there is no need. It's good to explain the risks of getting this treatment when she doesn't need it, and we should decline the request to do these veneers. And it's also even more beneficial to offer an alternative treatment, which would be the option of bleaching. Now let's go through these other answer choices. A. Inform the patient that there is no need. That sounds good. Explain the risk. That also sounds good. But we lose it here when they say, if they insist, do the veneers. No matter how much they insist, you should not ethically do a treatment that you do not think is beneficial for the patient. You think it is more of a risk than a benefit, you should not do it. C. Refer them to a dentist who is more willing to do the veneers. Even though you wouldn't be the one doing the veneers, it's still unethical to refer them to someone who will do it because it's unethical to encourage them to get this treatment. And D, agree to do the veneers regardless because patient preferences take priority. Patient preferences are super important under patient autonomy, and it's definitely good to take into consideration what treatment a patient wants. But it's unethical for them to insist and try and convince you to do a treatment that they don't need. It would put more risks on the patient than it would benefits. So it's definitely B. Now let's take a look at the relationships we as dentists have with the public through the lens of community service. The dentist should use their skills and knowledge to enhance the dental health of the public while also preserving the reputation of the profession. This means that we should be using our training to help the community in a manner that places the profession in the best light. Another aspect of community service that falls under beneficence is being sure to do good and to promote safety for the public as a whole, just as we would for our patients. This is where weighing ethical obligations comes into play. We weigh these obligations during a public health emergency, such as COVID-19. During these emergencies, a dentist must ethically choose to proceed or postpone a treatment based on the current situation. For example, the middle of a pandemic may not be the best time to be whitening teeth or doing other elective care like aesthetic veneers, but we should continue to provide emergent care like extracting an abscessed tooth. It is all about ethically weighing the risks of spreading the virus and putting the public in danger versus the benefits of providing a specific treatment to the patient. This decision all comes down to you as the dentist, who has to weigh both sides ethically before making decisions. Let's talk about a few more ways of honoring the ethical principle of beneficence under the Code of Professional Conduct. The first is self-governance, which essentially reminds us that each of us is responsible for self-regulation and for upholding the rules of ethics to continue to present the field and profession in the best manner. This also encourages us to join professional dental societies like the American Dental Association that promote these ethical standards. The next one is research accessibility. We have an ethical responsibility to share any research to promote public health and advance knowledge in the field. Say you magically come up with a way to reverse cavities. It is your ethical obligation to share this information to the public, as it would benefit the welfare of the community. On a similar note is patents and copyrights. Dentists are certainly allowed to obtain patents or copyrights, but these should not limit other research or professional practice. So back to that example of the magical cavity reverser. You are allowed to secure a patent on this as the dentist who discovered it, as long as this patent does not restrict further research into the product or restrict it from being used by other dentists in private practice. The last aspect of professional conduct that falls under beneficence and seems obvious is concerning our professional demeanor. We are to establish an environment with mutual respect, communication, and collaboration. We should always ethically promote a positive workplace environment, and it is our job to mediate any hostile situations that may arise in the dental office. It is our job to be a good role model and not engage in or promote any disruptive behavior. The last topic we are going to go over is incredibly important for the boards and for your real-life experience and practice, and it concerns abuse and neglect. Now, just to clarify, abuse involves actually inflicting damage, whether it be physical or emotional, while neglect is the omission of necessary care, such as unmet basic needs like clothing and food. It is our ethical responsibility as a dentist to be acquainted with the signs of abuse. These can include bruises, bite marks, fractured teeth, or burns, and signs of abuse need to be reported to the proper authorities. One consideration to keep in mind about abuse is that we need to uphold the confidentiality and self-determination of adult patients who choose not to report abuse. Even if we notice the signs and suspect abuse, if an adult patient chooses not to report a case of abuse or neglect, and it is not required by law in your state, you must respect that decision. With that being said, reporting requirements differ depending on the jurisdiction, and it is our job as the dentist to become familiar with the jurisdiction's requirements and act accordingly. Now, respecting that decision not to report abuse is only for adult patients. If you see child abuse, you need to report it and talk to Child Protective Services immediately. Do not investigate any further. It is not your job. Once you suspect child abuse, it is mandatory to report this abuse, both ethically and legally. As a mandated reporter for child abuse, we want to record any information we can, such as descriptions of injuries or inconsistencies in parent explanations, and immediately deliver that information to Child Protective Services. But remember, if we see adult abuse, we want to assess first and report the incident only if the patient is okay with us reporting it. Now, a lot of people get confused on why mandatory reporting of abuse would not fall under non-maleficence or the principle of doing no harm. This is because we are not the ones inflicting harm in this scenario. By stepping in and reporting signs of abuse and hopefully preventing future abuse from occurring, we would be doing good, which falls under the ethical principle of beneficence. By now, we've looked at many circumstances where beneficence comes into play, so let's test our knowledge with some practice questions. Example number 2. Which of the following is mandatory for a healthcare provider to report? A. Impaired healthcare provider. B. Patient with opioid addiction. C. Suspected child abuse and neglect. Or D. Patient's refusal of treatment. Now go ahead and pause it and think about this question. The correct answer here is pretty obviously C. Suspected child abuse and neglect. We are mandated child abuse reporters, and it's something that falls under the ethical principle of beneficence or do good. Let's go through the other answer choices. A. Impaired healthcare provider. We are not obligated to report that. B. Patient with opioid addiction. We don't have to report that either. Or D. Patient's refusal of treatment. We definitely don't have to report that, although we should probably make a note of it. The only thing that we're mandated to report is suspected child abuse and neglect. Example number 3. Which of the following actions violates the principle of beneficence? A. A dentist securing a copyright on their practice name. B. Allowing an elderly patient to take frequent breaks during treatment. C. Treating a decaying tooth before bleaching teeth. Or D. Not reporting child abuse. Go ahead and pause it and think about this question. The correct answer here would be D, not reporting child abuse. We are mandated reporters of child abuse, and not doing so would violate the principle of beneficence or doing good. Let's go ahead and look through the other answer choices. A dentist securing a copyright on their practice name. That is perfectly acceptable as long as he's not endangering the welfare of the public or keeping beneficial things from the welfare of the public. B, allowing an elderly patient to take frequent breaks during treatment. This is something we would actually encourage under the principle of beneficence. We want to treat all aspects of the patient and make sure they're comfortable. C, treating a decaying tooth before bleaching teeth. This is also something that we would encourage under the principle of beneficence. It makes sense that the correct treatment sequence would be treating a decaying tooth before bleaching teeth, which is an elective treatment. So the answer here is absolutely D. Example number 4. An elderly man comes in with his daughter and her boyfriend. There are clear bruises on the elderly patient's arm. What do you do? A, ignore it and focusing on treating the patient for their dental needs. B, talk to the family and investigate the situation. C, refuse to treat the patient and avoid any involvement. Or D, talk to the elderly man alone and report the incident if needed. Go ahead and pause it and think about this question. The correct answer here would be D, talk to the elderly man alone and report the incident if needed. Although we are mandated reporters of child abuse, we only would report instances of abuse in adults if they want it to be reported. So that's why it says report the incident if needed. We do not have to report it if the adult would rather us not. We also definitely want to talk to him alone. We don't want to B, talk to the family altogether, because then you're putting this adult in a vulnerable situation. We want to talk to him alone. It's also not our job to investigate the situation like B says. Now A, ignore it and focusing on treating the patient for their dental needs. We definitely don't want to ignore it. We definitely want to bring it up for the welfare of the patient, and we should be treating the patient for all their needs, considering all their needs and not just the dental needs. And then C, refuse to treat the patient and avoid any involvement. There is no reason here to refuse to treat this patient, even if they show signs of abuse. And we don't want to avoid any involvement. We want to talk to the patient and see if we can help them. Before we wrap up, let's do a quick recap of what we went over in this video. Under the ethical principle of beneficence, we need to prioritize the well-being of the patient, improve community dental health and the welfare of people, and identify signs of abuse and report it. Alright guys, that is it for today's topic. Thanks for watching and see you next time!